Estimated some 55,000 Vermonters will suffer from an eating disorder in their lifetime. Eating disorders are both a mental health issue and a physical health one. So how do clinicians help manage the complex intersection of those and get patients on the road to recovery? As part of my ongoing investigation into eating disorder treatment in Vermont, I visited the Kahm Clinic in Burlington to find out. Kahm Clinic Registered Dietitian Elaina Efird always has food behind her desk.
Each of these cubes are an ounce of cheese.
Not real food, rubber food.
So it's really to clarify, to figure out exactly how much they're eating.
She uses it when eating disorder patients come in to help them show her what they're eating.
Like, this is what a normal plate of food looks like. Whereas someone with an eating disorder would be like a quarter of that. And they're like, that's plenty of food. I'm like, no.
With these models, she then shows them what a healthy plate should be.
But with food, a lot of people think they can do it on their own.
Can they do it on their own?
No, that's actually a big misconception with eating disorders, is that you can do it on your own. And that's why a lot of people don't get the actual care that they need, and why their eating disorders last or progress for longer than it needs to.
And coming up with their recovery strategy starts with a body baseline. One of the treatment tools that the Kahm Clinic uses is something called metabolic testing. It basically tells the person what their body is doing, how many calories it's burning while it's at rest, what type of fuel is it using, and that can tell them what an eating disorder does to their body. And Elaina is going to show us how it works.
And this is just going to go over your head.
It feels like being in a spaceship. Once I'm in, Elaina says, just relax.
You're going to breathe for 20 minutes.
By measuring the carbon dioxide I breathe out and the oxygen I take in, the machine shows how many calories I'm burning, so a dietitian could see if I was burning more or less than I should be. And if I weren't eating enough, how much of my lean body mass, like muscles or brain or organ tissue, my body would be using to replace the fuel that's not coming in from food. In my first report on eating disorders last month, one of the Kahm Clinic's former patients, Amelia Cassidy, credited her recovery in part to the clinic's use of metabolic testing, because she said the numbers don't lie.
I could see the numbers clearly in front of me. And Elaina took this like no BS approach where she was just like, listen, like, these are the numbers. Like, I'm not making something up, because I had spent this entire year almost like paranoid that people, you know, my doctors and my parents were like out to like make me fat, this fear of being overweight. And it turned into this paranoia. It was them against me.
Efird says it is common for people to doubt whether their eating disorder is serious, especially if they've been praised for losing weight. A metabolic test shows them the damage not eating enough is doing to their body.
And it really helps actually with the patient's buy-in, right? A lot of times people come in, they're like, I don't think it's that bad. We do the metabolic test and they're like, oh, maybe I do need help.
She can then use a body composition analysis that measures fat and lean mass to track their progress or regression over time. Efird says their clinic also tries to create a team for their patient, a therapist, physician, even a psychiatrist too. But there are limits to what she can do, seeing someone once or twice a week for an hour or so.
They might need a lot more than that. They might need meal support 3 meals every single day, and none of that is available in Vermont.